Welcome to Inland Insight with IECN, hosted by Manny Sandoval and Denise Berber. What's up, Inland Empire? This is Manny Sandoval, and welcome to Inland Insight with IECN.
And I'm Denise Berber.
And today we are focused all on food deserts. There's so much misconception about food deserts in the Inland Empire. Are they real? Are they not? And so we have a expert, and she is a pediatric hospitalist at Loma University Health, Dr. Gabrielle Pina. Thank you for joining us.
Thank you.
Yeah, thank you guys so much for having me. So I'm Dr. Gabrielle Pina. I'm a pediatric hospitalist for Loma Children's Health. But I think what makes me more of an expert is the desire that I have embedded into the community advocacy and being a born and bred IE, like love of the IE. So right. Born and raised in Moreno Valley, I think that gives me a little bit of street cred to be able to talk about that. But I have a passion for my community, so this is where my heart lies.
Very nice.
That's awesome. And so, as I mentioned, some people say, recently I had published an article on food deserts and kind of just touched on it from a surface level. And in the comments, there was two people going back and forth about it's not a food desert. There's food all around us, but a lot of times it's processed foods, a lack of, farmers markets, a lack of grocery stores with nutritious food like fruits and vegetables. So can you kind of define what a food desert is and where we see food deserts in the Inland Empire?
Yeah, that's a really great question. And in fact, even the definition of food desert varies based on the sources in which you read. So I'm using the USDA, so United States Department of Agriculture definition, which describes low-income communities with lack of access to fresh fruits and vegetables within a mile of their home. Okay. That's the definition that the USDA has created. Some other definitions include the less than 0.3 miles of the home, which seems like that would then include quite a few communities. Right. Mm-hmm. But it's the low-income community with the lack of access to fresh fruits and affordable fresh fruits and vegetables. That's the other keyword that they highlight in the USDA.
And so when it comes to, affordable fruits and vegetables, this might be a dumb question, but we're going to get rid of that and say there's no dumb questions today. So what defines affordable when it comes to fruits and vegetables? Yeah,
so again, yet another good really follow-up question. So where the USDA kind of determines both income level and affordability is based on the federal poverty limit. So the federal poverty level goes all the way up to 400% of what they consider poverty to 60% of what they consider poverty, including beyond. They determine that 185% or less of federal poverty level applies to low income and also applies to an extrapolation of how affordable food should be. Mm-hmm. So they talk about how the cost of the food should not exceed more than 40% of their income, right? Mm-hmm. And so for a family of one living at 185% of the federal poverty level, they should make $2,400 a month, which in a year is $48,000, which is unreasonable to live in the state of California.
Right.
Yeah.
So if you're living at less than 185% and then up to 40% of your money goes to food, you will be living outside. Mm-hmm. That's just facts.
Especially in a day and age when people's housing is way more than 30% of their income.
Yeah, absolutely. So what ends up happening is these deserts continue to perpetuate itself.
Right, because people can go get a cheeseburger for $1, but they can't necessarily get fresh food for $1.
Absolutely.
Enough to feed their family.
Absolutely. So it's a cycle that is repetitive in nature, and I think highlights the inadequacies of our intrinsic policies that continue to perpetuate systems like this.
And there's an influx of fast food in the area, far more than there are an influx of fresh food, farmers markets, things like that,
absolutely,
which are pricey, and they can get pricey for a family.
Yeah, absolutely.
I mean, just take it for downtown San Bernardino. They, fought for such a long time for a farmers market, and it's actually held in the lot where our office is located. Yeah. But at the same time, they should technically be tended more for the community that they're in, but we've noticed that they are only really attended by the working community in that specific area and not necessarily residents in there. And so there could also be some type of correlation when it comes to affordability with that as well, because I mean, you really can't go to a farmer's market without, kind of $40 these days, it seems like. And so that's a tough, just ideation that we've noticed as well. And so when it comes to cities, that are prominent food deserts. Are there any examples of current cities that are struggling when it comes to grocery stores and affordability when it comes to fruits and vegetables?
Yeah, so I think what's helpful is I recently looked up some data that showed, and specifically in San Bernardino County, that there are 32 food desert areas.
Wow.
Scattered across San Bernardino. So there might be multiple in one city. So Hesperia is mentioned multiple times. Apple Valley and Victorville are mentioned. So there's pockets of food deserts within large cities. And then of those 32, 27 are majority Hispanic. And I think the other thing to think about when we talk about food deserts is sometimes people count gas stations as grocery stores because they have fresh fruits and veggies. But those are not what is considered true food or grocery stores.
Or little bodegas in a neighborhood.
Yeah, and it's not to slight the little bodegas or the gas stations, but those fruits and vegetables are really expensive.
Yeah.
Right, comparatively, so they're no longer affordable. And they do not have the same shelf life delivery as other larger grocery stores do.
Right. Those are all significant factors then.
Huge.
Yeah. So how do you feel with the current administration? What kind of budget cuts are we looking at in these types of programs?
Oh, yeah. This is the first that's going to go away. Like if we're thinking about supplemental nutrition, like SNAP programs, after school programming, food during lunch and breakfast for kids, the way that the economy works in the United States is they only really focus on the now, not the future. Right? So if you aren't able to get a job and contribute to the baseline capitalism and economy of the United States, then you're on the chopping block. Because you're not immediately pouring into our reserve and improving our fiscal deficit. So all the programs that support people who are immediately pouring into the financial budget and eliminating the fiscal deficit are the things that are going to be eliminated first.
Wow. And potential for huge consequences down the line.
Yeah, but it doesn't seems to matter right now. We're very much in a like today, not a like 20, 50 years from now.
I always say that no one really knows what we're doing. It's just everyone's just going with the flow and getting through the day almost. So, so and I want to verify, you said 32 cities in San Bernardino County are food deserts. And so how are these families managing this crisis, basically? What does it look like in their communities on a weekly or even a daily basis with their relationship to food, nutritious food, and processed food?
Yeah, I think from the families that we take care of, they're just trying to survive. Like, honestly, the amount of money that has paid into rent and then making sure your kids sometimes are able to see the doctor, that maybe you could see the doctor, maybe you can feed your family. The list of priorities goes on and on. So when they're thinking about making sure that their kids eat, at the end of the day, the apple versus the burger doesn't matter as long as they get food and what makes the most sense for their how much they can stretch it, right? So I actually recently looked at a housing neighborhood in Victorville, because Victorville is also one of the cities that has been mentioned in multiple times, different parts of Victorville, as a food desert. And it's a nice suburban neighborhood, right? Everything you think you would see. It's still about 4 miles from the nearest grocery store, right? 4 miles with a car is like 7 minutes drive.
Right.
But if you're a single family with a single car that is dependent on a working individual, then you have to rely on either walking or public transportation.
Right.
Do you know how long it would take to walk to that store? Apparently, per Google, 48 minutes.
Wow.
One way.
One way in the summer with all your kids.
Yeah. And then back with all your groceries and your kids in the heat.
But what about public transportation? Longer, 55 minutes, because there's no direct route and you go completely around the city to get to the actual store.
Wow.
So that also brings up the topic where it's been proven that a lot of kids only eat or they may even have their only meal at school and their most nutritious meal at school. So during the summertime, it probably affects them more. And you've seen some school districts try to add summer programs to supplement that. So if the budget cuts are coming, that will also be affected, I'm sure.
Yeah, and we've seen it happen in other states. So Arizona, I want to say like 10 years ago, used to have lunch funding and then lost it for a year. And as pediatricians, we studied it and we found that kids encountered severe poverty during the summer.
Wow.
Severe, got maybe one, that was their one meal a day that they were consistently getting. And so the pediatricians advocated for increased money and funding to support those programs, and some of them were able to come back. And so, yeah, absolutely. It's incredibly detrimental, especially when we're thinking about the future of America.
Right.
Starving kids now do not make healthy, mature adults later.
So what health disparities have you seen from children who grew up in food deserts versus those who didn't?
Yeah, I was just reading, there's an article in Psychology Research that was published in 2023 that looked at the rate of mental health or mental health disorders in kids with obesity and those with not. So those who had obesity, which is a direct correlation to poverty, right? When you live in a land or a mindset of scarcity, you hoard, right? And you eat things that are otherwise not healthy or nutritious for you because that's all you have access to.
Right, and they're cheaper. You can get top ramen for what, 10 cents?
Absolutely, you get high blood pressure and diabetes, right? But they found that those kids with that obesity were 7 times more likely to have a mental health disorder than their non-obese peers.
Wow.
That's terrible.
And also, too, in a time, we're currently in June 2025. And so I'm not saying it for you. We all know it's June 2025. But for anyone watching, just to give that timestamp. And I hear a lot about even the prices of fast food rising. So is that also playing a detrimental role on the impact of a family feeding themselves and feeding their kids?
Yeah, but as a family, and I'll say this, I have 3+ kids. Well, I'm growing 1. I have 2 at home, and I have a bonus daughter.
Congrats.
Thanks. It's been great. But I think about time versus effort. Right. So if I'm going to pay an extra 2 or 3 or 4 or even $10, but I know my kids are going to get fed right now instead of me going home after working a full-time job while being pregnant and being tired, I'm going to pay it because at that my time,
convenience.
Exactly, right? And our families are not just working 1 jobs anymore. They're working multiple jobs and then coming home and taking care of a kid, which is another 16 jobs on top of that.
Yeah.
Right? And so we've got to really think about what they're valuing. And right now they're valuing their time and their peace of mind.
So it's also affecting middle class families as well.
Absolutely.
Obviously. Yeah.
The middle class is a myth. We can see it continuing to widen. Where there's now upper middle class, lower middle class, how much more divided can we get? So it doesn't matter. In fact, they just had some statistics that came out that said in order for a family of 4, right, 2 adults and 2 working adults and 2 children, that to live comfortably in the state of California, you need to make 200 and something thousand.
I've seen something similar, and I think it was in Orange County. Now, if you are making as a family less than $100,000 per year, you are deemed poverty level and qualify for programming.
Absolutely. Which is great. 6 figures and you're poor?
Yeah.
That's wild.
That's crazy.
What are we doing?
Yeah. Totally don't understand that. And so, I think me and you spoke over the phone a couple or a few months back, and I think we were talking about a whole different topic, but you gave some tips. And what I really liked and respected that you said was it's never at all to shame a parent, because parents at the end of the day are doing the best that they can to, keep their family fed, keep their family safe, keep their family as healthy as they possibly can be. But what tips that are tangible would you give a parent that is living in a food desert, or maybe don't even realize or are realizing for the first time, maybe I am living in a food desert? What tips would you give them that they can do on a weekly or daily basis just to even get them started?
I think really incorporating your kids into the shopping experience, right? We tend to, okay, kids, we're just going to run the store, get X, Y, and Z, and then we're out, in and out. But I think teaching them early on, 1, good pricing. My mom is the most thrifty fiscal shopper you will ever meet. And to this day, I know how to pick out the best watermelon and the right way a fruit should look. And I know what prices to accept or not accept. And so really incorporating them early and being we're going to try this fruit or veggie this week. You can pick it, whatever fruit or veggie, but we're going to try it this week. Right? And then having them a part of the meal plan process and having them a part of the planning helps them create long-term sustainable habits that then maybe deter them from going to fast food when they know they can cook this meal at home because they've already done it with mom as they age, right? We are seeing a lot in pediatrics, a delayed adolescence, right? They are teenagers until they're mid-20s because they stay at home a lot longer and when they stay at home, we do a lot more for them. They're not learning how to balance bills or checkbooks or pay rent or do laundry because they're still at home because it's too expensive to move out, period. Right. But there are ways to incorporate independence while still understanding that financially they're not in a place to move on. So I think step 1 is making intentional grocery habits with your children and your family and making meal plans.
Yeah.
Yeah. And kids can cook. Kids can
Absolutely.
make some small things. They can help you.
They can cut.
Chop up vegetables or, put food away, separate it for the week and, that kind of thing. But it is a dedicated effort.
It is. Yeah. And meal planning itself is a dedicated effort, right? So my family has just started meal planning because I'm really tired of how picky my kids decide they want to be. Like, we're not going to play that game. Whatever gets cooked, you eat. And that's how we roll, or I guess you're hungry. Like, I don't know if I particularly care. But the ads come out, like the preview ads come out on Tuesday and the otherwise ads come out on Wednesday. So my mom and I sit down with the like digital ads and we go through and we go, all right, so we've got tomatoes, watermelon, lettuce, they're on sale at this store and they're all this in this like market. Now we are privileged enough to have more than one car, but we make an intentional effort to shop once a week.
Oh, good.
Right. Because that's when the ads are good and we know what kind of meat we have. And so we plan our meals for the entire week. Now, are we going to deviate every once in a while? Absolutely. No one's perfect.
Yeah.
But we know that we bought 17 tomatoes, and all 17 tomatoes are going to be used this week because we are using tacos this day, burritos this day, salad this day.
Yeah.
We're not wasting food, and I think we could do a better job of that, like just across the world.
And that's the thing. You plan it out because how many times have we bought the box of, greens and we're going to use these this week. We're going to make salads. We're going to use them in our sandwiches. We're going to.
And then they're looking at you on Sunday.
Yeah, the week gets away from you and you're like, oh, you have to throw away a box of rotten spinach.
Yeah, and that's, again, loss of nutrients, loss of funds, loss of time, right? And then your kids are like, oh, so mom's going to like not make us eat spinach again. Yeah. Right? They're watching everything you throw away because you say you're going to make them eat, try that radish or that carrot, whatever. Yeah. And then you don't incorporate it. They're like, sweet. So I just need to distract mom all week.
That is fun.
A lot of it's convenience. Have the bowl of tangerines on the table so the kids can grab them on the way out the door. And
Yeah.
So when it comes to grocery shopping, you mentioned you do it once a week. Is that something you would recommend, or is it just something that kind of works for yourself?
It works for myself. My mom used to shop 3 or 4 times a week when we lived closer to grocery stores because she just liked to have fresh things then. I think it depends on your household. If you have a single car, once a week makes sense because you have to work around the work schedule, right? But also you want to think about when you're going multiple times to a store, that's more gas, it's more time, right? There's always a chance that you will inevitably pick up something you don't need. Right? So just being conscious and conscientious of like what your list is and sticking to it.
Yeah.
So what staples can you recommend that we should all have in our pantry ready to go in a quick bind? You want something healthy for the kids, filling.
Yeah, I think if you have access to fresh fruits and veggies, I love a good cutie. I feel those little tiny mandarins go a long way, and it feels like everyone can just pop one and eat one.
Purse or
exactly. Oranges are almost too big, right? And the kids struggle with peeling it, so they don't know how to do it. Fruits and berries go too fast, especially in these like heated areas. It's just hard. The little apples, they have like school apples.
Oh, really?
They're perfect. They're like half the size of a regular apple. And so if you have access to those, things that are bite-sized and seem easy to pick. It's better to bag a big bag of carrots and just put small snack sizes all in the fridge so the kids can grab and go. Right? It's all about what's easy and accessible. Yeah. Right? We stopped buying Uncrustables and just started making them. Right? Because Uncrustables are stupid expensive,
especially Costco, the giant box.
They're so expensive, but like now you buy like a bread on clearance for like $1.15. You've got a big tub of peanut butter and some jelly, and you can make a solid 12 for like $1.50, right? At the end of the day, once you've made it. And so incorporating the kids into that, like making fun shapes. Yeah. And then all I do is put it into a Ziploc and put it in the fridge, and they grab it when they want.
And bread you can freeze.
Bread you can
stock up, freeze it, and pull it out as you need.
So I'm a big fan of a good PB&J, making sure we have like snack size carrots, apples, and cuties if they're in season. My kid is real big into cucumbers, so we always have cucumbers in the house. And honestly, those suckers last, right? If you do them right and cut them up good. So those are the fresh ones. As far as like other staples, whole wheat pasta. So we should really try to make the move to whole wheat whenever possible.
And what would be the major difference between regular?
Yeah, so whole wheat pasta has more fiber and is more like nutritious in its value. Regular grain spaghetti is fine, but it's all like simple sugars. Yeah. So it breaks down super fast, right? Gives them like a super glucose jump and then does not sustain.
Then you probably crash.
You do, which is great for bedtime, but maybe not so great for long term, and especially considering things like diabetes and A1C, right?
Yeah. And not to mention when you have your food prepped like that, okay, maybe it's intentionally for the kids, but you see it, oh, I'll grab some carrots too and I'll have those on my lunch. Or I'll grab a cucumber and, snack on that instead of going down or spending money on a $12 salad or something.
Absolutely. And I think we tend to skip breakfast, which is kind of a problem.
Coffee, lots of coffee.
Yeah. So I've been doing a lot of overnight oatmeals, which are super cheap.
Yeah.
Honestly, you don't even have to use milk or yogurt. You just take oats in a jar, add some water, some fruit, and whatever flavoring you want, and you leave it in there overnight. And the next day you have like an overnight oatmeal and you're good to go, and it's super sustainable. It lasts you until lunch. And it's not something you have to prep much. You could do it all in the beginning of the week if you wanted to and just have a whole row of jars, but you have to commit to eating it. Right? Like it's we're modeling behavior for our kids. So if we make something and decide not to eat it the next day, they now know that that's a freedom of choice that they can choose too.
Yeah.
Right.
Yeah. And I think too, just making the effort is a giant step forward, is just moving with something tangible that you're able to do, even if it's one thing, could make a lasting impact on a person and their life and their health and whatnot. But you mentioned something earlier that I kind of want to dive into a little more, which was, you said delayed adolescence, right? So that paired with, the lack of maybe nutritious food as well. And then you also mentioned there's like a link to mental health effects and whatnot and implications. Is there any type of correlation between the three of those?
That's a really good question. I would presume there is. I don't have any studies off the top of my head, but if we think generationally, right? So we are in a very large generational spread. We have everything from boomers to Gen Alpha, right? That's our newest generation that starts this year.
Wow.
Oh, wow.
Right? So we are spanning boomers, Gen Y, millennial, or Gen X, millennials, Gen Zs, and then Gen Alpha. So we have 5 generations of kids being raised and adults aging. And every person's a little bit of parenting has changed, right? So I'm a millennial. I grew up with the latchkey generation. I was not a latchkey kid because my mom was a super helicopter mom, but most of my friends did. They walked home from school. They had their own keys. So these parents are now raising kids in a super protective environment because they never felt protected, right? The latchkey kids were just trying to survive because their parents had to work 2 jobs. And now they want to be super present with their kids, so they're super hovery.
And did COVID, I would say, probably played an even greater part on that, especially when it comes to food and food access? I can only imagine that was an even harder time to get your hands on nutritious food.
Yeah, absolutely. COVID exposed a lot of the system failures that we have. Now, whether or not we've changed them since then seems to be up for grabs, but it highlighted not only issues in our healthcare system and infrastructure, but also how we teach, access to food, right? Safe living environments, because we also worry a lot about child abuse.
Yeah.
Right? Specifically in San Bernardino and Riverside County, which are one of the largest counties with highest rate of child abuse, is during COVID, teachers weren't seeing kids.
Right.
And so our reporting rate went down dramatically. And then once COVID lifted, we got a lot of kids who've experienced quite a bit of trauma during COVID.
So in terms of food deserts, how do you feel that that's indicative of a larger broken food culture in the United States?
Yeah, we've definitely regressed from our cultural beginnings, right? So if we think about the United States as its marker in 1777, right? Like when we became a nation, we grew everything ourselves, right? You lived in a community with your family. You took care of your community. We have regressed very far into this egocentric, independent viewpoint of life. I think we need to go back a little bit. I'm not saying in 1777 because I would not be in this position if we were back in 1777. So let's just be real. But I think the idea of having a multi-generational household, if it's positive for your household, should be a thing. I think there should be more community gardens.
Yeah.
Oh, yes.
Right? There should, and that should be city supported. Right?
And most of the times it's not.
No, it's community led.
Community led advocates.
Yeah,
start a
but
garden.
it should be city started and it should be city funded with community engagement.
Yeah.
Right? And so I love a good farmer's market, but they upcharge hard. And I want to value the work that they do because bringing your product to a farmer's market and selling it is a big deal. And it is. But if we could do a little bit just to grow staples, potatoes, carrots, lettuce, right, year round, and then engage the community where that becomes something of a focal point, I think we would do a lot of good, not just on the nutrition side, but how we engage with our neighbors, how we resolve conflict, how we view the world that we live in.
Because it becomes a community effort.
100%.
It's all encompassing. It's not just food. It's taking care of your communities and your neighbors' kids as much as you take care of yours.
Yeah, we need to deviate from an I to a we back. You know, we need to like really revert back to a we, because the I has not worked out well for us.
Yeah.
And it's making me think back to states like Hawaii. They've never let that go, where it's multi-generations in a household, because cost of living is so high out there. Why? Because of the non-natives that have gone over there for the past number of decades, ran those prices up. But it seems like the mainland is just getting back to that point. And we hear so many more conversations about that on social media right now, is, you know, growing fruits and vegetables in backyards and really trying to become as sustainable as we possibly can on our own. And as you mentioned too, that whole independence thing is almost like a social construct as well, that you know, defines success for a person or for a family, and not to, you know, rely on anyone and being like prideful or too prideful and whatnot. And at the end of the day, it really is potentially holding people back from living as healthy of a life as they can.
Yeah, I completely agree. I think I do a lot of community engagement work, specifically for pathway programming to get kids who may or may not have been interested in healthcare, because I think the future of medicine really deserves a diverse physician pool.
Oh, yes.
Right? And so intentionally going into communities that are Black and brown, because that is one of the lowest percentages for those matriculating, graduating from medical school. And every time we go there, the community rallies behind them. Right? It's really beautiful to see the community be like, oh, our future is bright because of these kids. But yet we don't rally behind community engagement projects that we don't see direct benefits from.
Right.
Yeah.
Right. And so I think we've got to exit the mindset of I into the mindset of we, and then lean into the longevity of it.
Yeah.
And it's not going to change overnight. It's not going to change for years. But if you can create a community that cares deeply for each other, that can change for generations to come. And we've got to be okay with not seeing it in our generation.
Right.
And I do like what you said about you and your own mother, is the day that the ads come out, you guys link up in our, you know, going through the ads and clipping them digitally, you said. So
yeah.
that's
my parents live with us.
Gotcha.
So
okay.
like my husband my parents have always lived with me since I had kids. I was married and then got divorced and was in residency, so just trying to survive. So my mom was like, I got you, boo, right? Like, she's dope.
That's awesome.
And so my dad has some disabilities because he got type 2 diabetes really bad with some like physical ailments. And so I was like, all right, we're building our little community commune. Like, we're doing this because not only can I keep an eye on you guys, because they're aging, right? Like, their health is not perfect. They're in their late 60s, early 70s, right? But also, like, they benefit so much from kid involvement. The studies have shown that when you involve grandkids and their grandparents in their life on a regular basis, it delays dementia and Alzheimer's substantially.
Wow.
They live longer. So I know that there are parents that are toxic. Facts, right? And I'm not saying welcoming those people into your life. But if there's someone in your life who is aging and has been a positive influence and can be a positive influence into your kids, consider incorporating them regularly, not only for the health and wealth of your children, but also for the health and wealth of them.
Right.
Yeah.
So getting back to that, what other issues are you seeing with adults in terms of health problems that, you know, are not being addressed?
Yeah. So the biggest one specifically in regards to nutrition is diabetes and high blood pressure, right? And so we're seeing a substantial amount of early diagnosis high blood pressure.
And is that also higher in the minority communities also?
Absolutely. In fact, the two most common causes of death in minority populations are heart disease and cancer, right? And we've seen a lot of young people with cancer, right? And so we're not 100% sure where all that cancer is coming from. There are a lot of theories that are surrounding about our genetically modified foods, right? We grew up on processed foods. At some point, that Lunchable meat was going to mold. I just never knew when it was going to, because I swear that sucker was in the fridge for years and looked great.
Yeah.
But heart disease is directly tied to nutrition, right? Nutrition plus genetics.
Wow. So do you see a legitimate benefit in spending $1 or $2 more for the organic, for the free range, for the grass-fed beef? Is that real? Is it a marketing thing?
I think it depends on what you can reasonably afford, right? Having one organic chicken meal a week or a month or a year, if you can afford it, go for it. But it shouldn't be the thing that determines whether or not you switch to processed foods versus just chicken in general. My family does not ascribe to the organic, not because we have any like literature to support it, but because at the end of the day, the organic prices are not $1, $2 difference. They're like $4, $5, $6 difference from the regular meals. And so until policy makes organic affordable, I'm not really going to recommend it to my communities, because I don't want them strapping thin to do organic and then not being able to make rent.
Yeah.
Right.
Right.
And there's not enough of a benefit.
Not yet. Not that. I'm sure
That's been proven.
Yeah, there's communities and there's some literature out there that definitely supports things like red dye, right? The
what I was
removal
gonna
of
get
red
to.
the removal of red dye has been studied and has been linked to like ADHD, not necessarily ADHD diagnosis, but hyperactivity, really spiking the system. And so I totally agree with removing dyes and processed foods, right? But you cannot remove them and not replace something of equal affordability,
Right.
because that's then you're leaving people in a food deficit
Yeah.
and not replacing it.
Right. It shouldn't be $10 organic strawberries or no strawberries. You know,
Correct.
there should be a middle ground.
Yeah, correct.
So back to the red dyes, what's the major detriment to people's health with them? And what are some examples of like popular snacks or foods that they are included in, other than, you know, hot Cheetos?
And Takis. Yeah. And fruit snacks, right? So there's a lot of red dye. Pretty much anything you're seeing in like Fruit by the Foot, any of the fruit snacks that
Grew up eating those too.
I have some in my purse right now for myself.
I love fruit snacks, but it's that's where the red dye is, right? And so, and those are like a fan favorite of the kids. Like, who doesn't love a good gummy snack?
I've been struggling with acid reflux since I was 12 years old because of hot Cheetos.
Yeah.
That's what started it. And nowadays I don't go near them, but I still like them.
They're delicious. I get it. But yeah, we have kids hospitalized for constipation from hot
gosh.
Cheetos.
And they just eat them like nothing. Little kids. Yeah, I see that all the time. And I'm like, oh, that's so bad for you.
And then Takis wants to, you know, drop a blue one that is like an Inferno version of the original, even spicier. And it's just wild. It gets crazier and crazier.
Yeah, and I don't want to pretend like I am anywhere near perfect with my kids. I will tell you, my 15-year-old eats like trash. Like absolute trash. Outside of the single meal that we eat together as a family and maybe breakfast that I can do like a Yoplait, like yogurt dip thing with him,
Yeah.
Homeboy's diet is atrocious.
Right.
And I am working on it.
Yeah.
But I recognize how easy it is to just be like, you know what? Just eat the chips and get out of my face. I need like 5 seconds of you like not whining or whatever over some chips.
Yeah.
Because the world is much bigger problems than
Right.
your talkie situation. But I do have really open, honest conversations with my kids. So he's now almost 15, right? So I have adult conversations with him because he needs to know about his health and his body. So every time he buys, like, because he has his own money, when he buys hot Cheetos, I go, okay, so when you start to have abdominal pain or you start to have poop that kind of looks like blood, I'm going to look at you. I'm going to take you to the doctor. And then I'm going to be like, so what are we going to do now? Because this is your body. In about 4 years, you make all your decisions and you pay for all of your bills. So I'm going to show you the bill that I just paid for today. And if you want to continue to pay that at 18, keep eating those hot Cheetos.
Right.
And one thing that I hear over and over again is eating habits. Those start when you are young. Is that correct?
Yeah, it is. Absolutely. So my oldest is my stepson that I adopted. I got him when he was 5. When he was 5, he came to me eating bread and cheese and meat. That was it.
Yeah.
Bread and cheese and meat. Those were his staples. And there's nothing wrong with bread, cheese, and meat until you've never seen something green.
Oh, yeah.
Right? And so we had to incorporate that early, and we tried a lot of things. We went through carrots, we went through apples, right? And we settled on one vegetable that he eats consistently.
Yeah.
Peas.
Yeah.
Of all the vegetables, peas. I can't even stand the smell. But I cook it. He eats it 5 days a week without any problems. piece.
Wow. So we have to remind parents that it's not an all or nothing proposition.
Absolutely.
Parents get really hard on themselves sometimes. Like, oh my gosh, I let them eat this. But it's not all or nothing.
No, and it's a relationship that you form with the kid, right? Because if you force them to eat something, they're never going to eat it again.
Yeah.
They're going to associate bad memories. So my youngest, who's 8 right now, he is a self-selected vegetarian. Has been since 18 months. The only meat he eats is an occasional, basically burnt bacon, which isn't meat at that point, or beef jerky. But at one point he was forced when he was out and about to eat mac and cheese and will never touch it. Like to this day, he smells it and will leave the room.
Oh my goodness. See, that's foreign to me because I love mac and cheese.
Same. So like, again, it's the habits. It's not all or nothing. You're going to have one kid that's a great eater and one kid that's not, and you're going to have someone in between, but that's okay. Celebrate each one of their wins, right? So every time my kid tries a new he tried a chicken nugget from McDonald's the other day. We partied. Had a straight up dance, but did he like it? Absolutely not. But he tried it. And then my oldest went like a week and a half without asking for hot Cheetos. And I was like, all right, kid, let's do this.
Yeah.
Right. So it's really individualizing the conversation and relationship that you have with your kids and not setting expectations that they themselves don't think they can reach. Right. It's their future. It's their nutrition. It's their body. Right. We want to give them a little bit of autonomy, but have rules and consequences for when they don't follow through.
And then the adults have to provide the example, like you keep saying.
Absolutely.
It has to start at the top.
Absolutely.
When it comes to school food, the food that schools are serving children, which, we mentioned a meal is for some students or kids, that's sometimes their only meal of the day that's, guaranteed. But are they also as healthy as they can be, or are there some refinements that need to be made at all, or what's the status on that you've heard or seen, or just any recommendations?
Yeah, I do think the school meals have come a long way. They have come an absolute long way, especially when you look at the elementary meals. High school, a little hit and miss, right? But you're also just trying to get teenagers to eat. That's like the teenage boys will eat whatever you put in front of them, but for the most part, you're just trying to make it active. But the elementary schools have been doing a lot of really good work on it, making sure that any kid that comes to get a meal has to pick up a fruit and a veggie. Got it. Right? So they have to. It has to be on their plate, and they're not allowed to throw it away. Right? So they can take it. They can be like, they have to go through the line. They have to grab the fruit and the veggie, and they can choose to give it back. Yeah. Right? As long as they haven't eaten it or opened it, because there's like a little container at the end of the line where they can donate it back for like snack for kids later. Gotcha. But just putting it on their plate and making them pick it up is an opportunity. Right? Yeah. There are things I don't think we ever need anywhere on a school lunch. We don't need chocolate milk. We don't. We don't. Absolutely not. Regular milk should only really be with breakfast. And even that,
I've always thought that was the weirdest thing.
Yeah,
is
why
getting
would you want
served
that
lunch
at lunch?
with milk.
Yeah.
I'm sorry, that sounds like a stomach ache instantly.
Well, now, especially the older you get,
with all the lactose people in the world now. It's,
Yeah. So like chocolate milk and juice, completely unnecessary.
Yeah, I think maybe it was even you with our last conversation. You said juice has zero nutritional value.
No, just eat the fruit.
Yeah.
It's just something that makes us feel good, right? Now, and I'm not talking about those like bougie juices that we have, right? The like green drinks and stuff.
Right,
but even that's super high in sugar. So if you look at like your naked smoothies, which are supposed to be super healthy for you, they have anywhere between 45 to 60 grams of sugar.
Wow, that's a ton. You might as well eat 2 bowls of cereal.
I'd rather have ice cream. Like, what are we arguing about right now?
Right.
You
Some people see, healthy, green, and take it and don't actually look at the labels.
Correct. So if we could revert back to getting these things that are easily processed or hidden, that's the other thing is I totally understand because I tried to hide cauliflower into my oldest's mac and cheese when he was like 6. He had it once and was like, this is funky, something is wrong, and he did not eat mac and cheese for a solid 6 months.
Cauliflower wings, though, I feel to me, they're pretty solid. I like them,
But it's because
they have to be cooked right, too.
And it's cauliflower, right? So when we start trying to be sneaky, our kids will feel deceived when they find out. So the more that we add vegetable powders to make sure they get it, or gummies that have, it's great. I think it's a great first step to making sure they get all the nutrients that they need, but it doesn't sustain long-term values. Right? So we need to get them to the point where they'll try the big piece of lettuce as opposed to you blending it into their morning smoothie. Right. They just need to.
It's making me think back to, the discussion on school meals when I was in high school was the transition when former First Lady Michelle Obama it was the whole initiative to make school meals healthier. And literally from one school year, I think it was before Christmas break, there was French fries, pizza bread all over. And when we came back, there was no more fries and all the chips were baked. Yep. And I mean, in retrospect, I'm sure that was a great, something great for all of us in our communities across the nation. But at the time, I'm like, what? Where's my fries? I don't even know what I want. Now I got to eat baked Lay's. Are you joking? It's wild. But yeah, it goes back to just little small refinements at maybe even one meal a week, as you mentioned, or one organic meal a week, or just something. And so when it comes finally to bring it back full circle to food deserts in the Inland Empire, what is one of the major recommendations that we can leave our listeners on or viewers on that they can start doing this week that is tangible?
Yeah.
It doesn't cost money.
Yeah. I mean, it's starting to heat up outside. So be aware of that. That means it's going to affect how things last and like what you're able to do with your kids, which means they're going to get restless, they're going to get bored, and they're going to be at home and they're going to want to snack. So I say if you are doing your weekly or whatever grocery run this week, you don't buy the French fries. You don't buy the soda. You don't buy the juice because they're going to get bored. They're going to go straight for the soda and the juice and the French fries. Yeah. You buy the cuties instead. So find an equivalent price thing in which you were going to buy anyways, and buy the healthier version. Right. So if you're going to buy, because Coke is expensive.
And you got to buy 4 packs to get the 5th for a decent price.
Right. So like if you're spending, I think there's maybe on sale right now, there's like 3 12 packs for like $12 or whatever. Then use that $12 to buy 3 different fruits. And instead of them going for a Coke or instead of them having access to a Coke, they now have access to a cutie, maybe a cucumber sliced, or maybe a packet of carrots. Yeah. Now, will they absolutely hit you? 100%.
Yeah. 100%. Or you can blend some berries with water, freeze them, and you have ice pops.
Also possible. Yeah. Will they absolutely abhor the idea of not having a availability of soda? Absolutely. But
they'll live.
But correct. Correct. And they will adjust. Yeah. So your like sensations for sugars and salts change pretty rapidly. So if you do a true detox in about a week or 2, you will no longer crave the sugar and salt like you did. Oh, wow. So you can make some really healthy habits to occur over the summer that dramatically change how they taste when they go back to school. Wow.
So I know we were just about to wrap up, but what does it mean when you are craving sugar or when you are craving a salt?
Yeah. So my mom, taking it back to my mom. She has type 2 diabetes, and we got her on Noom for a little bit because insurance covered it for a little bit. Noom is like a app that goes through the psychology as to why you eat what you eat. And what I thought was really cool is I kind of did it with her. I didn't do Noom, but we like talked about what the cravings meant. So for most people, when they're craving sugars, it's because they're, one, tired. Oh. It's like the biggest trigger.
They need a boost.
They need an immediate, so the body is going to crave fast sugars to process and release glucose, right? So that's when you pick up the candy. That's when you pick up the soda. That's when you pick up the Red Bull, right? Because you need that like little kick, right? But why do you need that little kick? Why are you tired? Right? What time are our kids going to sleep during the summer? What are they doing?
Whenever they want.
Right? What time are they waking up? Is their sleep good? Do they have sleep apnea? Right? And so it goes back to like, are we doing the basic things of activity, exercise, and sleep? Right? So everything pretty much correlates back to that. And then stress. Right? Stress is that other component and which triggers things that just make us feel good. So I know when I'm super stressed out, I roll through McDonald's. It's my jam. A good 20-piece chicken nuggets and fries and a Diet Coke is like, brings me back to my childhood where I felt safe with no stress.
Centered.
Right? And so really sitting and intentionally being like, do I really want this slice of cake or this soda? Or do I just need a break? Yeah. Do I just need a few minutes to like recenter myself? And do I need to look at the quality of my sleep and really look at myself?
So the cravings are generally your body telling you something else is going on.
Yeah, it's a warning sign that something is not okay inside.
And people need to pay attention to that. We get so wrapped up in everything, we're not paying attention to the signals our body's sending until it's too late sometimes.
Absolutely.
So I'm going to admit, I reach for the chips. Salt. What exactly does that mean when you crave salt?
So salt is usually a sign of dehydration.
I was just going to say that, yeah.
Yeah. So if you're not drinking enough water, you will eat salt because salt forces water into your blood vessels.
Gotcha.
So your body is going to say, hey, your volume's a little low.
Mm-hmm.
Eat some salt. Let's draw in that water so I can feel better.
Mm-hmm. Wow. Got it. Well, Dr. Gabrielle Pina, thank you very much for joining Denise and I.
Yeah, thank you guys for having me.
Of course.
Are there any other resources you can recommend our audience can check out for more information or?
Yeah, I mean, I'm a big fan of MyFitnessPal. It's an app.
Yeah.
It's free. And it kind of gives you an idea because I think sometimes we think we're eating healthy.
Yeah.
And then we're like, absolutely not. We're like, oh, that was like way too many carbs for, right? And it's not a diet, right? Like I'm not trying to put anybody on a diet. That's not my place.
Yeah.
But we could do a better job of balancing the meal plans, right? And so MyFitnessPal is great. They also like will give you all the visuals and stuff. And then myplate.org is a like government funded website that actually shows you what like a balanced plate should look like.
Gotcha.
And it's really kid friendly, has pictures, and so the kids can play games and like understand where they come from. And so utilizing those couple of resources I think is super helpful.
So MyFitnessPal, and what was the second one again?
Myplate.org.
Myplate.org. Dr. Gabrielle Pina, we'll see you next time. Everybody, thanks for watching. This is Inland Insight with IECN. We'll see you next time.